Good evening, everyone, and welcome to CancerBuddy Conversations. And tonight I'm excited to welcome Dr. Julie Karen and Brittanny Groover, who is a melanoma cancer survivor. And I'm going to see if I can bring them on right now. Let me see here. She's coming on, and yeah, so here we go. Hopefully it won't be so difficult. This is the hardest part of this.
I see you.
That was very smooth. I'm excited that it happened easily tonight.
It's
Now,
so funny. His last name is Groover, but I've always been called Grover my whole life, so I don't take it.
Hi.
Okay, and there is Dr. Karen. Hi, Julie.
Hi, everybody.
Well,
Brittany, it's so nice to meet you officially.
Yes, and meeting Brittany. And I'm excited to have you both on and to talk about a very important topic, and one that you're very passionate, both of you are passionate about. And usually I see Dr. Karen when I'm in a gown getting examined. So it's kind of fun having a different situation tonight. And so anyway, I thought we would just start out the conversation. But first of all, I want to welcome you both. And Dr. Karen is a dermatologist, and she specializes in Mohs surgery and skin cancer and laser surgery and treatment of leg veins. And she practices in New York City with her sister and also affiliated with New York University Langone Medical Center. And Brittany is a melanoma survivor and a passionate advocate of melanoma and prevention, and to just get her word out there. So welcome.
Thank you.
Yeah.
Thank you for having us.
Yeah.
Christina, you've changed the face of the world of cancer, so you deserve an introduction as well. But we're honored to be here.
You're so sweet. Well, this is my passion, to get education out there for people to get more awareness around what they can do to prevent something like skin cancer and protect themselves. So I'm thrilled that we can do this, and so happy that you could both join us. So I guess we could start out by just talking about something very basic as skin checks, and how often should we be doing that, um, and so forth, and kind of what age you should start doing that at, because that's always a challenge with me having 4 sons. When to start that process.
Sure, I can start because this is something I discuss with my patients every single day. I am a firm believer in the importance of routine skin examination. The reason is, as we all know, skin cancer is more common than all other forms of cancer combined. And many forms of skin cancer are a little bit more indolent than most forms of cancer, and they may not aggressively become metastatic or potentially kill you. But the form of cancer that Brittany survived and suffered from, melanoma, can become very aggressive in a short course of time. So I like to tell all my patients that the bad news is skin cancer is very common. The good news is that even the most dangerous form, if we catch it early, is completely curable. And the way that we're going to catch it early is by partnering with our patients, encouraging them to be familiar with their own spots, check themselves, and we'll get more into this later, I'm sure. But seeing a board certified dermatologist at least, on average once a year. Once a year is like for the adult, and I say adult because until someone goes through puberty, their risk of melanoma is very, very low. It's not zero. And if you ever have on a child of yourself, or you yourself are a child, and you notice something that is unusual, please say something, because melanoma can affect any individual. But once you've gone through puberty, so I generally say around, age 15 to 18 is when you should start thinking about getting routine skin checks. And at that point, just make it a habit going once a year. If you have a strong family history of melanoma, if you yourself have had melanoma or other skin cancer, Or if you have a lot of atypical moles, you may be someone who would qualify for going even more frequently, but that would be something to discuss with your doctor.
Okay, great. And kind of speaking of skin checks, Brittany, when did you, realize and get diagnosed with melanoma?
Yeah,
And how did you find out? How did you?
I by the pandemic, unfortunately. I had gone to regular skin checks. I probably started around 19, and I went every year. I was young though, and I will say that, like Dr. Karen was saying, I wasn't watching myself or watching my body. I wasn't learning what to look for. I was just having the doctor check me, and I would leave, and it would be like in 1 year, out the other. Everything was good, nothing to worry about. So whenever it was upcoming my skin check in 2020, I skipped it because the world was shut down, and I was like, well, it's no big deal. Like, we're not supposed to leave the house. I'm not going to go. And by the time my skin check came for 2021, I not only had melanoma, the deadliest form of skin cancer, but it had spread to my lymph nodes, which kind of goes towards how she explained how fast and aggressive it is. I missed one yearly skin check, and it was stage 3A by the time we found it. Now, I will admit, I was watching it grow. It wasn't in a place that was hidden. It was right on the front of my shin, but I just wasn't educated on what it was. I thought it was ugly, sure. It was dry, sure, but never once did I think it was cancer. But it was.
Wow.
Yeah.
Yeah.
Wow.
Do you see patients like that, Julie, in your practice? Somebody that's kind of not sure what it is and they kind of live with it for a while?
Absolutely. I mean, thankfully, because of the efforts of people like you and Skin Cancer Foundation and all these other organizations that have really dedicated themselves to educating the public, and thanks to people like Brittany who are going out there and using their misfortune to save lives, um, most of the patients we see are at least aware that something that's changing should be evaluated. But in my practice, even in New York City, even among a highly educated population who has read the magazines, read the articles, heard the talks, been to doctors, I have had a few cases where someone will come in for the first time and say, they're nervous. Say, oh, I've seen this spot growing and it's even bled a few times, and I have you should probably check it out. But by then, sometimes it has been there a year or two, and in those instances, that can be too long.
Yeah.
Right. Wow. It really is scary. And in terms of symptoms to look for, what should we be looking for? You're talking about like something that's, an attractive spot or dry, scaly, what are the other areas?
So there's a couple of mnemonics that we use to educate the lay person, and they've proven very, very effective. If we talk about encompassing sort of anything that could be skin cancer, not specific to melanoma, but including melanoma, which again is the one we want our patients most heightened and attuned to the possibility of, we now say, and this is guided by the Big C campaign that the Skin Cancer Foundation put out, anything that's new, changing, or unusual. So once you get most of your moles during childhood. You start getting moles, which are pigmented lesions that, can look like brown or black spots. They may be flat, they may be elevated. You're born with some. They start to generally develop age 2 to 5. And then through the first 2 to 2.5 decades of your life, people continue to get more. But once you are past your 20s, you really shouldn't get new true moles. Now, you may get spots on your skin that are new that may look like moles, and that's not for you to figure out. This is why we just say if something's new, get it checked out. But there are other types of growth, age spots, seborrheic keratoses that can look like a mole that you can get into adulthood. But a true melanocytic lesion, meaning a lesion that's made up of melanocytes, the skin cells that lead to melanoma, those really shouldn't come with great frequency. So if you have something that's new, go get it checked out. If you have something that's new or old, so something that is, whether it's been there your whole life or a short period of time, or it just showed up, but it changes, you need to get it checked out. And this is such an important part to hammer home. Of melanoma, 80% of them are going to show up as a new spot. And Brittany, I'm curious, you'll tell us whether the spot on your shin was a new spot that just appeared and then you sort of watched it grow or whether it had been an old spot. But 20% of the time, a mole that you've had for 5 years or even your entire life can evolve into a melanoma. So if something's new or old, but it changes in size, shape, color, symptoms, get it checked out. And then unusual. If you have something on your skin that does not resemble all your other spots, if it's an ugly duckling, funny looking, distinct from everything else, doesn't blend in, stands out like a sore thumb because of its color, size, shape, or symptoms, get that checked out. Brittany, tell us a little bit more about your spot, and then if we can touch on the ABCDEs also, which is another helpful mnemonic.
Yeah, ABCDEs. Mine had every single one of them, of the ABCDEs. But after I got diagnosed, I went back like a crazy person in my pictures, just trying to find pictures of my leg. And unfortunately, how many people have pictures of the front of their shin? It's really not that common. You either have jeans on or leggings or whatever. But I did find it was a very tiny freckle, like maybe the size of a pencil tip. It was a very tiny freckle, and it grew to be the size of probably a dime. So it was big. It was an ugly duckling. It looked nothing like any of my other moles. It was splotchy. It kind of looked like tie-dye. And the biggest thing was it was dry and it was peeling. And it was like that spot was always patchy, and I always wanted to put sunscreen on it. Not the rest of my body, just something my brain was telling me, put sunscreen on that one spot right there, or lotion, something. And yeah, it grew from a little tiny little thing to bigger than a pencil eraser, which is a part of the ABCDEs that we can talk about.
So exactly. So you touched on the fact that it had many of the features of what we call the ABCDEs of melanoma. And these are 5 features that may be present within a melanoma. They may not be present. They don't all need to be present. But if you have a lesion that demonstrates one or multiple of these features, again, you want to get it checked out. A stands for asymmetry. The lesion simply cannot be folded on itself and have 2 sides match because it is asymmetric. B stands for borders that are irregular. So most common benign or banal moles have a rather even border that you could draw a circle around, and they're rather circular in nature. You mentioned that yours had sort of jagged or irregular borders. So if something has borders that are more scalloped, jagged, or just not circular and smooth, that could be a sign of an atypical lesion, because that's indicating that the spot is sort of growing aberrantly. It's not growing, contiguously, or didn't form contiguously. C stands for color variation. A lesion that has multiple shades of brown, or has brown, black, red, blue, white, any multiple colors. Most lesions that have a single color, and this is not always true, but if it has a single color, that's generally reassuring. If your spot has more colors, it's more heterogeneous, you want to be extra careful. D stands for, in the past, diameter. Now we use it to stand for either diameter or dark. Diameter simply means you don't have to have a spot that's big. Yours got big, but it was already pretty bad at that point. They can be big or small, but if you have a lesion that's larger than a pencil eraser, it is more likely to evolve into something dangerous, such as a melanoma. So pay closer attention. Similarly, if you have a very dark lesion, particularly if that spot is darker than all of your other spots, that could be a clue that it could be more dangerous. And truly, the most important is E, evolution. If something is changing that is not normal, never ever sit and watch something change. If you pick at something and it hurts for a day and it reverts to normal, that's not change. But if anything is changing consistently for a week or 2 or longer, you've got to call your doctor.
And how fast can something like a basal cell or something, or squamous cell turn to melanoma?
So it's a very, very good question. Basal and squamous cell are completely distinct from melanoma. So when we think of the 3 most common types of skin cancers, we have melanoma, which is the 3rd most common of those 3, but by far the most deadly. Basal and squamous cell we categorize as non-melanoma skin cancer. So the cell type from which those forms of cancer are derived is a different cell type. It is not a cell that produces pigment. It is not a melanocyte. It is a different epidermal cell, meaning a different cell that exists in our skin called a keratinocyte. And thankfully, while those are far more common, In fact, 1 in 5 adults will develop skin cancer of any form, and the vast majority will be non-melanoma skin cancer. They tend to be much more slow growing, very, very unlikely to metastasize or kill someone. Although even in rare instances, and basal cell, it's very rare for that ever to kill someone. Squamous cell, you can get, in certain locations, 3 to 10% of squamous cells that can go on to metastasize and cause death in an individual. But a basal and squamous will never turn into melanoma, but an individual who has had basal or squamous cell is at risk for melanoma. And conversely, if you've had melanoma, you're also at risk, greater risk for non-melanoma skin cancer.
Right. Brittany, did you have any basal cell or squamous cell before you got diagnosed?
No, I had only ever had one biopsy ever, and it came back clear, no melanoma, no basal cell, nothing. And that's kind of the reason why I didn't think anything of missing one skin check, because I had continuously gotten clear skin checks. But the biggest risk factor that is me paying attention to my own body at home and knowing what to look for, that's the big thing that I missed out on.
Can I ask you, Brittany, had you used tanning salons ever previously in teenage years?
Yes, I was addicted.
So that's unfortunately a great risk factor, and thankfully regulations have increased greatly for the use among, underage people under the age of 18 using them.
Yeah, we are working on getting the FDA to ban tanning beds because it's just unnecessary. I'm a little tan right now, but that's fake tan, and that works just perfectly, and it's safe and it's fine.
And it looks gorgeous.
Thanks.
And that's so interesting. I mean, in my earlier days, definitely, I would go to a tanning bed, and they would be at places, I think even like at different exercise gyms and things, like in the locker rooms, you could go and, go work out and also get a little tan. And I remember that so well. And also, I remember growing up in California, and I'd be sitting there, with the tinfoil and the, lemon in my hair and the olive oil or baby oil or whatever I had, any type of oil. And I just, think to myself, and now I don't even go in the sun.
Yeah.
What
were we doing?
And it shows. Yeah. You've made a difference. It's not too late to have made a difference, and you've.
And I probably have. I mean, so what kind of damage from your, when you are naive and you're not protecting yourself and you're not putting sunscreen in all your teen years, or, now you're an adult, what of that? I mean, is that when it really starts to kind of happen for you?
So it's a great question. It's one that we've studied a great deal. We used to think, and I think patients were frankly relieved, that by age 18 or 20, the damage was already done. So, I was foolish. I wish I hadn't been, but I'm not going to bother with sunscreen and caring for myself now. It's too late. The reality is that by age 18, we suspect that you've acquired only 22% of your lifetime damage, and that each decade thereafter, you acquire an additional 10%. So making changes to protect your skin at any age is going to be impactful. Now, unfortunately, that doesn't mean that if you, like, I have patients who are surprised to hear that even though they adopted sun-safe practices in the last 10 years, that after they come for a few years, that they have to continue coming because they're so careful now. But the reality is you are impacting the future health of your skin, but you are not reversing those years or decades of damage that you've had. So you can still see manifestations of sun exposure from your youth into your 50s or beyond, even if you're being careful now, although you will greatly reduce how high that risk is by being careful.
Mm-hmm. And in terms of, Brittany, in terms of like when you were diagnosed with melanoma, what kind of treatment did you have for that?
Yeah, so first they cut it out, do the biopsy, and send it off for testing. That's whenever it came back as being melanoma. And because of that, the next step is to usually do a wide local excision, which is where you go in and you take basically extra skin around where the melanoma site was to make sure that the margins are clear, meaning like everything's gone completely. And then because mine was so big, I unfortunately had to go in for a skin graft to be able to close my leg after my wide local excision because the gap was just way way too big to be able to close up on its own. And at that same time, they did called a sentinel lymph node biopsy, and that's where because usually with melanoma, once it starts to spread internally, the first place it can go is to your lymph nodes, and then your lymph nodes is what can flush it through to your liver, your brain, your lungs, etc. Mine did go to my lymph nodes, and then I was needing treatment, which for melanoma, luckily, is immunotherapy. I love the little nod you're giving me. I feel so special. Um, but immunotherapy was FDA approved in February of 2019. So being diagnosed in 2021, if I would have been diagnosed a couple years prior, I would not have even been able to get this treatment, but I luckily was. There's a few different options. I did Keytruda specifically, and I had to go in for infusions every 3 weeks for an entire year. So after I did that, I'm just skin checks every 3 months. I get PET scans every 6 months, and I just have to watch myself and fingers crossed that it doesn't come back.
Yeah. Wow.
Yeah.
And Dr. Karen, so in terms of, people, they're getting skin checks and they're doing this preventative care to catch anything early. Um, is it always where you're biopsying when somebody comes in? And I mean, I know that I've gotten things, obviously biopsied and checked. And I've actually had squamous cell a long time ago, and I haven't had it again in probably 20 something years, 25 years or so. But like, what are the chances? I'm just quite prone to that. So I have to just be vigilant about getting body checks.
Exactly. So the statistics vary a little bit depending on the age of diagnosis, your risk factors, and what type of skin cancer you had. With melanoma, Brittany mentioned she goes in every 3 months. And that is what we recommend. Once someone has a new diagnosis of melanoma, their risk of getting a second one is now markedly elevated, and that risk is greatest in the first 2 years. So we see all of those patients every 3 to 4 months for 2 years, and then in a minimum every 6 months thereafter. We're looking, of course, for melanomas. We're assessing the surgical site for any risk or sign of recurrence, and we're looking for other forms of skin cancer to which we now know that patient has an elevated risk. Basal and squamous cell, because they are so much more common, and again, because they share so many risk factors with each other and with melanoma, and most commonly that's fair skin, tendency to burn, ability to freckle, history of sunburns, a lot of outdoor exposure, exposure at higher altitudes. But once you've had one of those forms of skin cancer, you have at least you have a 60% risk of getting a second one within the next 10 years. But the reality is I think that probably vastly understates that risk. We really see patients who are repeat offenders. You were very fortunate that you had one, and for 26 years, knock on wood, you've been cancer free, and that's wonderful. And I think a huge part of that is you're having incorporated these tremendously prudent practices of protection, seeking the shade, avoiding sunburns. That's been a great benefit to you, as it will be to Brittany going forward. Because people who don't get diagnosed until later in life, they've accumulated so much more damage until and they're still seeing the risks from that previous damage manifest in the years that come.
Mm-hmm. And doing things like
interrupt real quick. That's a big thing that that sun damage accumulates. So it doesn't regenerate. Your skin doesn't regenerate itself or anything, and that was mind blowing for me. So that's why I'm a mom now. I have a son. He's 9 years old, and he was around 5 whenever I was diagnosed. And I've kind of equipped this routine where you wake up, you brush your teeth, you brush your hair, you put on your sunscreen. That's a part of your everyday routine. Spring, summer, winter, fall, it doesn't matter, because my best way to protect him, especially now that I have history of melanoma with me, is to protect his skin now so it doesn't accumulate even more.
Yeah, I was every day. I put on sunscreen when I go to my office. Just even sitting, and I think about you, because Dr. Karen, because I think about just light coming in from the windows or anything, right? And I don't reapply, which I probably should, but I put it on in the morning.
Yeah, you raise a very good point. I mean, a lot of people with office jobs or who drive long distances to work don't necessarily think that they are outside because they work in an office. But if their desk is situated close to a glass window, or if they are having prolonged exposure through even a car window on a commute to and from work, you do get penetration of the longer wavelength, ultraviolet radiation that the sun emits. It's called UVA. And we know that it penetrates not only through clouds, which is another myth that on a cloudy day you don't need sunscreen, but also those damaging rays can penetrate through glass windows, through car windows, and they are causing sun damage, DNA damage that can lead to skin cancer. And for those who are listening that really feel invincible and we haven't convinced you that you may be at risk for skin cancer, those rays also cause tremendous damage in the form of aging to the skin.
Yeah.
Wrinkles and fine lines and blotchy pigmentation and sunspots and textural abnormalities. So all of those harmful things, but especially most importantly, the skin cancer can occur if you are near or exposed to light through a window.
And if you get skin damage, like the brown spots on your face, can those turn into anything more, or are they just sunspots from sun damage?
It depends what the brown spot is. There are, because the sun, each time it's incident on the skin, is inflicting damage, to your cells. Anytime your body is producing increased pigment, when you get a suntan, that's actually your body's way of responding to DNA damage that the sun has caused. So the sun hits your skin, it induces damage. Your body doesn't think, but it, mechanically thinks, how can I thicken and darken myself to protect myself from further damage as I'm accumulating damage right now? And that's what brown pigmentation or a suntan is actually the manifestation of. It's your body's response to damage. So when someone gets sunspots, we don't consider freckles and sunspots precancerous per se, because the vast majority of them are just our body's reaction to sun exposure. But prolonged, repeated sun exposure in a particular area can absolutely, within one of those lesions, lead to degenerative change and skin cancer, just as it could in the adjacent skin without a brown spot. So they're not pre-malignant if they're truly a freckle or sunspot, but you can, if you observe change within what you thought was a freckle, it may just not be a freckle and you should get it checked out.
And let's say something is changing, you think it's a dark, damaged spot from the sun, and then you go and you get something like laser to remove that spot. Does that laser help you get rid of any kind of bad cells if there is something brewing there? Or
so glad you asked that. So what you're referring to, no. In fact, it can diminish the pigmentation. It can reduce how dark that spot is in the short term, which will mask the atypical changes that are occurring within the cells. So it actually could delay diagnosis of a melanoma. So that does not mean that brown spots can't be lasered off safely, but it does mean that if you have brown spots on your face, if they've been changing, do not just go get them lasered out without having them checked by a board certified dermatologist.
Yeah.
And if, and even if, certainly if they're changing, and even if they're not changing, you don't want to just walk into a spa and ask them to treat your brown spots as a benign sunspot, because not all brown spots are created equal.
Yeah. I personally have a friend, her name is Stacy, who had a spot on her cheek that she just kept getting lasered and thought it's ugly. I need to get it lasered. And she did that over and over and over again. And it was melanoma the entire time. And it delayed her this because she didn't know. And the doctor didn't think to biopsy it.
Wow. Yes. So it just goes to show you, which I always tell all of patients and friends of mine, it's, what medical professional you go to, and, to be able to be diagnosed correctly right away and not have delays. So that's really scary. And it also just kind of, puts home for me every time I go to you, Dr. Karen. It's like, if you see the smallest little thing on me, you definitely want to check it out. And I'm always thinking, no, it looks okay or whatever. But it just goes to show you that you have to really be so careful. And so I can see you as a doctor. Is that make you nervous? Just like you're always having to be like so careful not to miss something.
Absolutely. I mean, it's a privilege to be able to be entrusted by my patients to check them. But do not take for granted the fact that if I send them out of my office after a skin check and I tell them that I wasn't concerned about anything, like Brittany did in 2019, or 2018 before, they're going to feel that they got a clean bill of health and they may forget to come back in a year. They may miss it because of an epidemic, such as would happen with Brittany. So I feel that burden. I feel it every day. And that is why I try to partner with my patients. And I do say, look, I am going to check you as best I can, every nook and cranny. I'm going to inspect you. I'm going to analyze. I'm going to check whatever I'm concerned about. But I could send you out here today and you could develop a dangerous or even malignant lesion in the next few months, well before your next scheduled visit. So I beseech them, please just make a habit. You don't have to go crazy yourself, but if you just spend 2 minutes a month after you get out of the shower, just glancing over your skin, you'll start to recognize the patterns of your moles, whether you have a few or a lot. You'll just become familiar with the landscape. And you may indeed just identify something that suddenly is new, changing, or unusual, and it can save your life. We know that when patients notice things themselves or their partners notice things themselves, they're generally caught in an earlier stage than when a physician diagnoses it, because it avoids that time lapse that is requisite to a once-a-year scheduled visit, in terms of the interval before it's diagnosed.
Yeah, definitely. And are there certain parts of your body that is more prone to skin cancer than others? I mean, I'm thinking obviously, parts that are exposed to the sun, but
So Brittany highlights what's very important, that in women, the lower legs is the most common area. Hers was on her shin, so she could actually see it. If God forbid it had been on the back of her leg, she might have waited another few months or a year before it was seen. But the lower legs is the most common for women. The upper back and shoulders and trunk is the most common for men. Now you may be a little bit perplexed, like, well, that's interesting. Why isn't it the face that gets the most sun exposure? And if I dive a little bit deeper, I can explain that basal and squamous cell, particularly squamous cell, are much more common on the chronically sun-exposed areas, such as the face, the tops of the ears, the backs of the hands, the neck and chest. But melanoma has sort of a unique footprint, the way that it develops. It's more likely to occur in an area that is the recipient of acute intermittent sunburst exposure. So most of the year, our legs are covered because it's either chilly or we're wearing pants. Then the warmer months come, we may start wearing skirts or shorts, and we don't have hairs covering our leg like men do. So our lower legs get these, rapid sort of intense bursts of sun exposure. And while we intend to be very careful protecting ourselves with sunscreen every day, many of us now, thank goodness, are good at protecting our face, but we're not quite as diligent at putting on sunscreen on our lower legs and reapplying it. And the same is true for men. They may go to the beach that first summer day, their skin is pasty as it ever can be, depending on their skin type, and they get that intense sun exposure. So it's generally protected. It has not adapted to the frequent sun exposure, such as our face and other chronically exposed areas, but then receives acute, intense sun exposure in shorter bursts of time. And it's that type of exposure that leads to melanoma, which is why it's the lower legs for women and the trunk for men.
there was a question that somebody asked, does the SPF clothing that people buy, does that really work?
UPF. I have a UPF hat on right now. I love it. It's a good addition. I still wear your SPF regardless. Mm-hmm. And then if you want to wear UPF clothing on top of it, that's just making sure that, because you're supposed to apply sunscreen or reapply 80 minutes. And so in between them little spurts of where your sunscreen might have rubbed off or it's not active anymore and you haven't reapplied it yet, the UPF clothing can be really helpful to kind of protect you in them in between areas. Plus, they're really cute now. Like whenever I was in my younger 20s, I'm like, UPF clothing, that's like, I would judge it unfairly. But now it's so cute. I love UPF clothing.
Yeah, I would go further as to say it is like superior to the best, most diligently applied sunscreen, sun protective clothing, because so UPF, which is a term affixed to clothing that offers sun protection, of 50 blocks entirely 98% of the sun's rays. And that is irrespective of whether you put it on an hour ago or you put it on 5 hours ago. It maintains its protection. You can get good protection from any dark colored, tightly woven fabrics. They sort of work like UPF, but UPF, you know it's blocking it. Sunscreen, an SPF of 50 technically also blocks 98%, but the way that we all apply it in practice is unfortunately just very inadequate. And that's why people will come in, or you may have noticed, I put on 50, but I got so tan, you know, I must not be getting damaged. Really, it's because they're putting on a tiny bit, not coming close to the 50 approximated on the bottle. Whereas with UPF, you know what you're getting.
Yeah.
That sounds like my son's. I mean, my son, when he was younger, I think he's a little bit better about it now, but he would just put on just like a little bit. It would be just the tiniest bit of sunscreen because he hated the feeling of sunscreen. I'm like, that is not going to do anything. So, you know, total argument with my boys as when they're all younger. And yeah, that's frustration to see so many kids get burnt. And I even have, I mean, my kids are in their 20s now and they still get burnt. And I just think to myself, you know, I guess they have to learn, but they, you know, go out and they don't put enough sun protection clothing or sunscreen, which leads to another question, like sunscreen being 40 or being 75 or the highest that you can get it. Does it make a huge difference what level you're putting on?
So when properly applied, the difference between an SPF 30 and 50 is negligible. It's 95% of the rays versus 98% of the rays being blocked. But in actuality, because we are all applying so much less than we should, I mean, we should be going through an 8-ounce bottle of sunscreen every 2 days on vacation for a single person, not a family. How many people have taken the same bottle on vacation after vacation? The whole family shares it. I mean, they're not even coming close. And unfortunately, when you apply less than is requisite, you get not a linear dilution of that sun protective factor. You actually get more of what's called a logarithmic dilution. So you quickly go from blocking 98% of the rays to blocking closer to like 20 to 30% of the rays if you're applying less than you're supposed to. So in that case, we say opt for the higher number, apply it liberally. You'll give yourself a little bit of leeway, but you still need to put on generously and reapply.
Yes.
For the face, you should have 2 full strips of sunscreen just for your face. So now imagine that for your whole body too. You apply all over, and the armpits and the heels of the feet, like the places that you feel that you don't have to. You can get skin cancer on the palms of your hands. You can get it on the feet, on the bottom of your feet. It's important to wear sunscreen all over, even the places you don't want to touch, like your armpits.
And Dr. Karen, when you see your patients coming in after the summer months, and here we all now are post-summer, and this conversation reminds me that I have to get into you, so hopefully I'll see you in the next couple of weeks. But in terms of just, do you see a lot more patients with issues after the summer, or does it matter really what time of year?
Because although skin cancer can grow rapidly, it's not like interestingly enough, we don't see a dramatic increase in the months right after the summer. We sort of see it constant throughout the year. So anytime that's convenient for a patient to get checked out, come in. So often patients are naughty over the summer and they'll cancel their appointment, or they'll admit that they consider canceling their appointment because they didn't want to come in with a tan. I mean, I'd rather see you with a tan. I'll give you a short lecture. I won't spend the whole time lecturing you. Rather see you and know that you're getting checked than have you defer it because you're worried that you didn't behave according to my strict instructions.
Yeah, that's, I think that's probably a common reality for some of your patients not coming to you right away. And there's also another question in terms of is there any tips on getting sunscreen off of you? Is sunscreen not great for you, because of toxins and things like that?
I don't concern myself. I respect patients' concerns. Patients have a lot of concerns about what they put on their skin, what they ingest, and I respect that all. But as someone who has followed sunscreen, and been sort of involved in the discussions around the safety of the particular ingredients. They are tried and tested, and we know that they prevent cancer, and they have never been proven to cause cancer. So as much as I can reassure patients, find a sunscreen you're willing to use and use it, but do not fret that you are exposing yourself or your loved ones to harmful ingredients.
Yeah, sunscreen is safe. And then she asked also how to cleanse your skin to remove mineral sunscreen, because minerals can be a little bit harder to take off, which I understand. Personally, I like oils, like oil cleansers, because it helps break down the sunscreen. Or oh geez, what are they called? I'm blanking. I'll message you after and I'll tell you.
Is there anything else that we haven't covered tonight? Because it's getting almost near the end of our conversation.
I could talk to you guys all
Yeah,
day.
Brittany, tell us, the two messages you feel most important conveying to people, given what you've been through.
Well, we've kind of gone through the major ones. Sunscreen is safe. Find a sunscreen that you like. It's not your typical, like back in the day, I used to hate sunscreen because I felt that they were all white cast and they had that sunscreen smell, like that fake beach smell. But there are so many brands, even popping up every single day, making their own sunscreens and their own textures and their own styles. And it's really possible. Like I said, oil. I love oils that have sunscreen in it because I have very dry skin. I usually use mineral sunscreens on my face and then chemical sunscreens on my body, just specifically because mineral sunscreens tend to dry out my skin and it just doesn't work for me. So I go out and I find oil sunscreens, like the Supergoop Glow Oil is one of my favorites for my body. Kroger has a dupe. It's like $11. It's my favorite. You can get serums that have sunscreen in it. It's just not your, if you haven't gone out and tried what's new out there today, it's not the typical stigma of the white cast sunscreen that it used to be
like
a decade.
Like zinc or something like that.
Yeah, I mean, it's still available, but they've really upped the ante whenever it comes to sunscreens. You can find one you like, you just have to search for it.
And Dr. Karen, what is any other comments or suggestions for any of us?
Just again to reiterate what we've said, that skin cancer, so many of the risk factors for skin cancer, unlike many forms of cancer, are modifiable. Like we can take action in ourselves and to protect our children to reduce our risk. And most importantly, because all forms of skin cancer, when caught early, are totally curable, I just can't stress enough how important it is to get checked. Check yourself, get checked, encourage those that you love to get checked because it really can save a life.
And
great. Well,
no tanning beds, no laying out by the pool. It is just simply not worth it. You are beautiful. Your skin is beautiful. And if you want a little bit of tanning, that too. But just no tanning beds.
Yeah.
Scratch it out of your life.
It's a good message. So, yeah, when I see people that are really tan, I think to myself, they really are doing the wrong thing for themselves. And
it's wild. I used to think, oh, it's so beautiful. And I just realized that was my perspective. And perspective is everything. I say that all the time. And next time that you look in the mirror and think, well, I would just feel prettier if I had a little bit of tan. That is completely not true. We are all beautiful. Our skin is beautiful. It is the largest organ of our body. And we only get one skin for our whole entire life. So we have to protect it and love it. And tanning is not protecting it or loving it at all.
Yeah. Well, thank you both. And this is just, great information for people. And I don't think anybody can get enough of it, to kind of keep being reminded on how important it is to have sun protection and get your body checks and go to a great dermatologist like Dr. Karen and have great, advocates like Brittany. So thank you both. And I'll see you soon, Julie.
Yes.
And yeah, so that will be great. And anyway, have a great rest of your week. And I just so appreciate you joining us for CancerBuddy Conversation.
It was so fun. Thank you.
Thanks for having us, Christina, and thanks for all you do.
Take care.
Thank you.
Bye. Bye.